So welcome back to the Brighton Chamber podcast. I'm your host, Cameron Harris, and this week I'm joined by John O'Malley, the president of Trinity Health Livingston and Trinity Health Medical Center of Brighton, and Douglas Ferrick, regional vice president of Philanthropy for Trinity Health of southeastern Michigan. So John, I'll start with you. How is everything going with the new construction of the hospital in Brighton?
Well, so far things are on track. We're going to be opening the new hospital in March of 2026. We are, progressing nicely towards that date. At this time, nothing seems to be indicating, that date would not be achievable at this time. So, yeah, everything's going great.
Excellent. So, what are some of the biggest challenges that you've had with building this new hospital?
Bringing it to Brighton, putting it on the same campus as our medical center in Brighton, connecting the two. You can imagine you're designing with architects and construction managers a brand new state-of-the-art hospital, and you're connecting it to the medical center Brighton, which was built in 2000. So it's already 24 years old. And it takes a village to design and get everything right, because you're looking at not only state-of-the-art technology today, but setting it up to be successful in the future, hoping, we can design in the infrastructure to accommodate, things like virtual nursing and other technology that is on the horizon. And then mechanically, electrically, and from a plumbing perspective, tying it into a 24-year-old building. And so it's had its challenges, but we've got a really good team we're working with, and we've been able to resolve all the issues that have obviously come up. And the city, the township, the county have all been great to work with, and so we're very appreciative of their input, allowing us to move this forward. And I think we're going to bring a new hospital to Livingston County that people can rely on us to not only have the design, the acumen, and the infrastructure to continually adapt to shifting healthcare needs. We're going to support the latest technologies and capabilities, and to provide this healing environment for care that is patient-focused, local, and easy to access. And I think, that was the ultimate vision and is the ultimate goal for us, bringing the new hospital to Brighton, putting it on the same campus as our medical center Brighton. That will also allow us to gain some economies of scale and really provide ease of access for all of Livingston County and beyond, quite frankly.
Awesome. So what can people really expect for improvements in medical care services offered by Trinity Health in Brighton?
Expanded medical services that we're bringing to the campus in a new 174,000 square foot building that will have 56 acute care beds with the capability of going up to 96 beds in the future. So we've built in some growth in the new hospital. Along with renovating the medical center, we're going to have 18 short stay unit beds. We're going to have 8 licensed operating rooms. We're going to have intensive cardiac rehab. Our hospital-based medical and surgical specialty practice space that will help support not only the hospital, but also the ambulatory side of the campus. We're going to be offering not only primary care and general medicine, but gynecological surgery, urology, cardiology and intensive cardiac rehab, orthopedics, minimally invasive general surgery, bariatric surgery, and oncology. And some of the surgery we're doing, we're currently using robotic surgery, our Da Vinci robotic surgery platform, on both the outpatient and the inpatient side. We look to hopefully expand our robotic capabilities even more. I really think when we open the hospital, we are set up nicely to be that state-of-the-art facility that will serve Livingston County and beyond for decades to come.
That's exciting. I've heard that you maintain the mantra of keeping local care local. So what do you mean by that? And how has that idea guided your decisions that you've made as president of Trinity Health Livingston?
Yeah, and that's a great question. Local care local, I came up with, I don't know, it's been probably 7 or 8 years ago, maybe. And when I first arrived here in Livingston County, 10 or 11 years ago, the hospital was a small community hospital that did things well, but really didn't become a full service community hospital until we began to expand primary care, medical specialty, and surgical specialty in the community. And it's important because we really want our community to work with their primary care physicians. And in this case, it's our IHA medical group. We brought IHA medical group to Howell, East Brighton, South Lyon, Hamburg, Pinckney. And we actually have a new location going to be opening up on Grand River near Ladson Road. And so what this does is we can then manage the care of the community, but then you bring in the medical specialties and the surgical specialties so that the primary care physicians can refer to those specialties, keeping the patient local, not having to send the patient always to Ann Arbor or other larger tertiary type facilities. Not to say that you won't have a condition that, like open heart as an example, which we won't be providing here locally, that we will have to send you to Ann Arbor for those type of services. But from a full service community perspective, local care local is trying to keep not only the patient and care for the patient locally, but their families. Their families can be here to help support them locally instead of having to travel, all over, Southeast Michigan. Think of Livingston. When you look at other hospitals, there really aren't any hospitals close to us. I mean, there's, Novi is 26 miles away, Ann Arbor's 26, 7 miles away, Lansing's 20, maybe 30 miles away, 32 miles away, and Flint is just out of the question. So, we need to be able to try to keep our community local here and provide the services necessary, bring the services needed that are necessary to care for them locally here. And I just think it's better care. It's what the community wants. We listen, we partner, and we're going to try to make it very easy for this community to receive their care. We followed the people, process, technology, and culture regimen, and I think it's worked well for us over the last 7, 8 years that we've been on this journey. I will continue to hold by local care local as much as we possibly can, and it takes time to achieve that. But as much as we possibly can, we're going to have a full service community hospital that will keep our community local, with the exception of when you need that very higher end service, like, for example, open heart surgery.
Yeah, no, I think that's awesome. I think for people that makes them feel more like a person to the company rather than, a number or just a dollar sign. So I think that's
Yeah, absolutely. I've always, in all my talks to the community, and, I've always said, we're going to bring the services here necessary to care for you without having to ship you here, there, and everywhere. And that's really local care local. And it's again, we're partnering with the community. We're looking at what the needs of the community are, which is very different than maybe some of the wants of the community. I mean, I think some community members might say, "Well, we want open heart here." Well, it's just not realistic to do that.
mm-hmm.
And so, we're really looking at the needs closely. We're trying to partner with the community, and we're trying to make it as easy as possible for them to receive their care here locally. As an example, we just approved our second fixed MRI for the Brighton site, our third CAT scan, which one of those CAT scans includes a cardiac CT, which this community desperately needs, again, to keep that community local. And then, of course, we're going to expand our women's center. We just received approval for that, which is also in our medical center in Brighton. And so we'll be adding 3D mammography units, 2 more 3D mammography units. So we're addressing the needs. We're seeing that the the community is committing to Trinity Health, committing to the care we're providing, and we're trying to make it very easy for them to access care.
That's exciting. To kind of shift gears a little bit, Doug, what is the fundraising goal for the new hospital and how much has been raised for that?
Well, thank you, Cameron. The fundraising has been underway to raise money for the new hospital under a tenet of forging our future. That's what we're calling our campaign. We've been raising money for the past almost 2 years. And the goal that we had is 5 million, which would be the largest amount we've ever raised in Livingston County to date. And so we are on pace to meet and or exceed that by next spring when John mentioned opening of the new hospital. So we're really thrilled that we're able to have the support and engagement of our community in Livingston to really step up and step into this transformational healthcare opportunity that really is once in a generation.
Yeah, really. So, what have been some of the challenges that you face with fundraising and how have you kind of gotten around those?
Two challenges really come to mind, and one is what I just sort of referenced related to fundraising. When we launch this type of a project, there's an exponential need to raise more dollars than we have ever had to bring this amazing project to reality. And so one of the things that we did is created a community campaign cabinet, which is comprised of 18 members throughout Livingston County who work with us day in and day out on raising dollars, creating awareness, bringing people into our house, as it were, to learn about Trinity and this amazing healthcare resource that will be available to everyone in Livingston County and beyond. So that was one, and that's sort of how we addressed it by the power of many, of community stepping in with us, and it's been a beautiful experience, I think, for everyone to have that. And that the second challenge is really the understanding that Trinity Health is a nonprofit. We're not a big corporate entity, but a nonprofit organization where whatever we bring in, we reinvest in our people and our equipment and the needs of our communities we serve. And sometimes when you think healthcare, I think you think, it can be like insurance companies and all this money. And we work on a very small margin and we carefully manage what we have to ensure that we can provide the best care. And I think that's an example of, and credit to John's leadership of the hospital in Livingston and this whole project. He's been an amazing leader for all of this.
Yeah. So, with that, what's your vision of how philanthropy will continue to play a role in the hospital's development and growth over the next few decades?
Yeah, that's a big charge, but we're encouraged by just the general support of community. And as we continue to grow and enhance and identify needs that Livingston County has, we're going to continue to build and grow our volunteer supports to help us raise funds and to help educate those in our community about what we're doing, why we're doing it, and how they can play a role to be a true, authentic partner with us to deliver quality and premium care to those who need it.
Yeah, awesome. So, for people watching this and they felt the need to donate, how could they do that exactly?
I think the easiest is to go to Google and type in Forging Our Future Livingston, and it'll pull up a page that will give you some background on the campaign as well as a link to make a gift. And so I would say that would be the easiest route. I would like to take a moment, though, and just give a shout out to Scott Griffith and Kelly Myers. Those two have been incredible. They are our campaign co-chairs and have really rallied and led the charge to bringing Livingston County leaders of all levels into this campaign to help build our success. So I have to give them a prop where a prop is due, and they've been amazing partners in this mix.
Awesome. Well, we'll be sure to include that link for donating in the show notes. So anyone that feels led to donate, just go right down there and fill that out. John and Doug, is there anything else that we didn't touch on that you guys would like to bring up real quick?
Just a couple comments at this point. The community needs to know and understand that we, Trinity Health Livingston, we don't generate huge margins. We don't have stockholders or shareholders or anything like that. We're able to build a new hospital because we floated bonds and we have to repay them back over the next 35, 40 years. So it's almost like a mortgage. That's our commitment. $250 million, our commitment to this community. And I think that in doing so, we rely heavily on donations. The margins we generate aren't enough to pay that back and afford all the new technology and equipment. So it's really important that we develop a foundation, a philanthropy that allows us to acquire some of the equipment that we're going to need to care for this community going forward. The other thing I wanted to say was, our new Trinity Health Livingston Hospital is really going to serve our patients who rely on us for coordinated care. So, and coordinated care means many things, but the one thing I think our patients will see is from an electronic medical record perspective and our MyChart, whether they're here in Livingston County receiving services from Trinity Health, or they're in Ann Arbor, or we're a national organization, perhaps at one of our hospitals out of state, they will have that access. They'll have that continuity of care will be evident in that electronic medical record. Today's healthcare is really quite complex, and our patients' experience is improved when we make it easy for them through comfortable, familiar locations, close to home, an expert interdisciplinary team that works in coordination to provide personalized care. And our mission really is to heal body, mind, and spirit and make it easy for you. And so, with that, I want to thank you very much for this podcast. I appreciate you allowing us to get the word out to hopefully educate our community about what we're doing. All we want to do is care for our community.
Well, of course. Glad to do it. Doug, did you have anything else that you'd like to add to that?
I would add that every gift is important when we run a campaign of this nature. I don't want your listeners to think that, gee, it has to be some big gift. Everyone that steps in and makes a gift of any level to us as a nonprofit organization is a value added partner and helps us bring about the reality of the kind of care we're working to achieve in Livingston County. And with this opportunity of a new hospital, which does not happen every day, for your listeners, if you're a corporation or a foundation or a family and you're looking to kind of create a legacy opportunity, this could be a really intriguing fit for you. So I encourage you to give that some thought, your listeners, and to reach out to us if you'd like to have a conversation. But every gift matters. You're all important to us, and we welcome your support, and we're so grateful.
Definitely. So you mentioned people reaching out. Where would be the best platform for them to do that, or to get updates on the construction, or just any information in general? Where would you recommend they go?
I would go back to Forging Our Future Livingston, and there's contact information for people you can speak with. There's a giving link, and then there's a summary of what's going on. So that's really the universal go-to.
Awesome. So we'll be sure to definitely include that link in the bio. That about wraps up this episode for the Brighton Chamber podcast. We'll catch you next week.